And now the Ministry of Health has attributed the delay in distribution of the 4 billion shillings worth of essential health commodities that remained undistributed at the Mission for Essential Drugs warehouse to lack of sufficient distribution mechanisms and authorization of the organization to distribute the products. The essential health commodities, including ARVs, were flagged off today for distribution across the country, and will see at least 1 million people living with HIV continue with care. Gloria Milimu now more with reports.
As the country seeks to address the current HIV response hurdles due to the unprecedented U.S. government funding freeze that has disrupted the distribution of essential health commodities, Friday, critical programs that had been severely choked by the aid suspension got a reprieve. The clearance of a consignment worth 4 billion shillings that had remained undistributed at the Mission for Essential Drugs warehouse now set to neutralize the panic and uncertainty that had been witnessed across the country, especially among people living with HIV.
This shipment includes antiretrovirals for over 1 million patients, ensuring continuity of treatment for people living with HIV and helping us move closer to the 95-95 targets.
The main ART regimen being used by over 92% of all ART patients, both adults and children. Currently, there are 2,026,555 packs at both Kemsa and Meds, translating to 4.7 months of stock. Over 4.8 million packs will be delivered between now and June 2025.
Today's flag off really is one step in ensuring that the commodities are going to reach the last mile.
The government has attributed the delay in distribution to logistics glitches that spiraled from the USAID freeze.
What we did not have is the distribution mechanism. Meds did not have the authority or the free hand to distribute the products. So by restoring, we are saying that the Ministry of Health, we have taken charge.
U.S. President Donald Trump's 90-day suspension of development assistance has left Kenya shortfall of 1.2 billion shillings to cater for distribution of PEPFAR-procured commodities.
We are actually using our framework contracts with our logistics service providers and our internal resources to ensure that we deliver these commodities to health facilities as we await funding from the donor.
Other commodities distributed include TB medicines to help with continuity of medication by patients and help avert drug resistance and transmission of the disease that affects at least 140,000 people annually in Kenya. The consignment also included malaria commodities set to be distributed in high-burden counties located in the western parts of the country, the Lake region, and coastal areas where malaria prevalence remains high. In total, Kenya requires at least 30 billion shillings to suture the gaping finance wound left by the U.S. government order. Gloria